Thank you very much for joining us today. My name is Jim Sinclair. I am the chair of the Fraser Health Authority, and joined today by the executive team and by board members, which will be introduced later. I just want to say my apologies to everyone. We were all here with you this morning at 11 o'clock. Unfortunately, the technology wasn't with us. And so we are attempting today to do something different. Which is that we will be having questions that you've sent to us, and we will be answering those questions. But also, we wanted an opportunity for people to give us live questions. And so that was the new technology, and I'm hoping it works this time and that you're all here today with us. On the regards of the questions, we look forward to your questions. If there are duplicate questions to what's already on our list, we won't be responding. And we also hope that we won't be reading out questions that aren't respectful. As well, if you have a personal story to tell, we prefer that not be shared publicly, but we will be getting back in touch with you to see if you wanted to share that with us in a private way or to get responses to your concerns. So again, our apologies for having to reschedule this meeting, but we're here now and we're looking forward to answering your questions and hearing from you. Before we go to the questions, I just want to take an opportunity to reflect on a few words of thanks. It goes without saying that for the 1.8 million people of the Fraser region, it's been a difficult time. We are the largest region, and we also had the largest number of cases of COVID, 100,000 cases, and of course, subsequently, the largest number of deaths. And our condolences go out to those people who have lost loved ones. We probably all know somebody who we have lost during this pandemic, and it's been extremely large challenge for us. But as we've shared all these challenges, I want to say what an amazing job people in the region have done, and what an amazing job the healthcare workers have done. We have seen healthcare workers step up to the plate in ways in which they've never had to in the past. Not only step up for an emergency, but that stepped up for almost 2 years. 2 years of incredible work, where at times our hospitals were to the full and going past full, to where the number of people coming into the hospitals was at record levels. We also are challenged to provide testing services and ultimately the vaccines to well over 1 million people. That also required 7,000 additional staff to be hired and to be delivered, and they did an amazing job. But as I say, none of it would have worked if the people in Fraser region had not stepped up and had offered to be vaccinated. Vaccines were no good unless they were in people's arms, and we have one of the highest rates of vaccinations in the province. And I think that's something that we're all very proud of. As we head into the fall and winter, we remain resilient to the challenges. I wish we were meeting today to say that it's over, but it's not. And we still have challenges. The Delta variant has been a very aggressive variant, and we are still facing many challenges in terms of meeting the needs, keeping people safe, and making sure that everybody gets the vaccines they wanted. And also, we're now looking at third doses for some people. To do that. There is optimism. I have a lot of optimism. I think people in general have optimism because of and hope for what we're doing. And we draw that from many places. 2.9 million vaccines have been given out. It's almost a staggering number, and it was done in such a way. And I want to say we appreciated all of the feedback we got from people on how they felt it was done and the way it was organized. And that was so important. That's approximately 89% of people have 2 vaccines, and for first doses, and 84% for second doses. A little plug: if you've got your first dose, please come and get your second. It makes you more immune and protects other people too. I just want to give another example of all through this period, and in smaller ways across the region, people have done things to help each other, to take care of each other. And I learned recently about the Langley Memorial Hospital nurses and volunteers from the auxiliary have been working together to knit sleeve covers for patients that have dementia. The colorful sleeves prevent patients from pulling out their IV lines and are calming addition when they're receiving treatment. They've made over 75 sleeves and helping dozens of patients in their recovery journeys at the hospital. So I just wanted to share that because when I heard that, I thought that's also above and beyond. It's about caring for each other. And I think that's what this is all about, is taking care of each other. And that's what public health care is about. And I want to thank everyone in Fraser Health who you've shown that care to your community and you've stepped up to help us. So again, thank you very much, and appreciate respecting the rules, wearing your masks, taking care of each other. And I think by doing that, we are going to get through and come out the other end of this pandemic. I just want to take a second to introduce the board members. Manpreet Grewal, Tom Kim, Nicole Nassim, Ramya Hazak, Inderjeet Hondo, and not with us today are Willie Charlie, Jesse LaHale, and Opreet Kane. We also are joined by some of the hardest working people in the healthcare system, which is the senior executive team of Fraser Health. Let me tell you, the number of hours they've put in is amazing over the last year and a half and continue to put in. And with us today is Victoria Lee. She's the CEO and president of our organization. She's the one that's given us the leadership over the last year and a half or 2 years, a year and a half, although she's been with us for, I think, 2.5 years now, Victoria. And I want to introduce her and turn it over to her to introduce the executive and to say a few words. Again, thank you for joining us today.
Thank you so much, Jim, and the board members. I'll start by acknowledging that we're joining everyone from the traditional and shared and unceded territories of the Coast Salish people, specifically Katzie, Kwetlan, Coquitlam, Tuasin, and Semiahmoo First Nations. And the executive team that are here, we have Cameron Bryan, Norm Peters, we have Naseem Nurani, Lori Leith, and Elizabeth Brodkin, as well as Dermot Kelly, Brent Crucial, Ralph Bell, and Linda Dempster. And we're also joined by our board secretary at Christiane Taylor as well. So, oh, sorry, I missed Brenda Liggett, who's our CFO and VP for system optimization. I'll move forward with just a short number of comments. I like to start by acknowledging our Fraser Health family. There's over 40,000 people that either work or volunteer in the region to serve the population in our region. And as you mentioned, Jim, the past 20 months have been quite challenging, not only from the pandemic, but also we had the heat wave. We've had a lot of concerns with wildfires and supporting the province in that area, and continually facing the dual public health emergencies of both COVID pandemic as well as the overdose opioid crisis. So everyone that's in front of kind of healthcare services, providing those healthcare services, as well as behind the scenes in corporate areas, have been working day in, day out to ensure that we protect our health system, and also provide high quality health services to all that need them. And it would not have been possible without partnerships with our both provincial and external partners. So provincial health partners such as Ministry of Health and other health authorities, as well as divisions of family practice, but also municipalities, WorkSafe BC, BC Housing. I think COVID and the overdose emergencies have demonstrated the impact of a broader determinants of health. And this has also been very encouraging and inspiring time for us to review what we currently do, what kind of services we provide, and how we can improve those services so that they're seamless. We provide care where services are better integrated, as well as protect those populations that are most vulnerable in our communities as well. So I think with COVID-19, the pandemic and opioid overdose crisis, as well as our work to reduce racism in our health system, we have seen some evolution of our health system, not only in expansion of our services, both on primary community care, but also in acute through many capital projects. We have large capital projects that are underway with New Surrey Hospital, Burnaby Hospital, and Royal Columbian Hospital, but also additional areas of emergency department expansions and MRI and other diagnostics. I think we're also broadening a new way of delivering care, such as virtual care, and at the same time keeping an eye on quality of that care that's provided, and looking at how we look after people that are providing our services. So as our VP for People Services would say, care people can take care of others as well. So I think it's important that we look after our Fraser Health family during this time so that they can look after our communities and populations. So with that, I'd like to thank everyone for joining us today, and apologies again for the technical difficulties. And I'll turn it back over to Jim, our board chair, and again, acknowledge and thank the board's role during this difficult and challenging COVID pandemic time as well.
Thank you, Victoria. We'll start with some questions that were sent in ahead of time, and then we'll move on to any live questions. This question is from Joanne in Surrey, and she asks a question: when will hospitals make their own food and factor in patient preferences in the food being provided during their stay? Well, I'm happy to say that in the vast majority of our hospitals, we do make all our own food in the hospital. And we do provide, where possible, choices for people in both long-term care and in the hospital situation. But we do have 3 sites, Langley, Peace Arch, and Surrey Memorial Hospitals that do not have on-site food. However, we all agree they should. And so we have a plan now to move to Peace Arch hospitals and to increase the and to build a new kitchen there for local food. And then we're going to move to Langley and then finally tackle Surrey Memorial Hospital. So over the next period of time, we'll reach a point where all of that food is being delivered on site and prepared on site. And we'll also note that as per the provincial government order, there are several hospitals that don't have on-site have contracted services. Those employees will be coming back into the Fraser Health family and doing that again. Thank you. And I just, oops, hang on just a second. Thank you. The next question is from Sharon in Coquitlam. And that question is, board certified physician who has passed all of her exams and is looking for volunteering at hospitals or other healthcare facilities and looking for Canadian experience, but no one accepts volunteers due to COVID-19, and it is truly frustrating. I'm going to ask Inderjeet to answer that question. Over to you, Inderjeet. You're on mute, Inderjeet.
Thanks, Jim. Sorry about that. Sites are experiencing a high volume and backlog of volunteer application due to COVID. Some sites closed their volunteer application links due to backlog. For instance, Surrey Memorial currently has 900 plus volunteer applications currently to be processed. There have been limited volunteer opportunities due to COVID. Thank you.
Thank you, Inderjeet. The next question is from Helen, Tony, and Charmley. And really the question regards vaccine, multiple questions regarding, we got a number of questions on this issue, and that was really about vaccine requirements for employees and the enforcement of PHO orders related to the proof of vaccination program. And I'm going to ask Elizabeth Brodkin to answer that question, who's our Chief Medical Health Officer.
Thank you very much, Jim, and thank you for the question. This has certainly been a challenging issue and one that has that we've all spent a great deal of time on in the last few weeks. Using her authority under the Public Health Act, our provincial health officer has written orders that require anyone who works in healthcare, both in acute care and in long-term care, to be vaccinated. The order for long-term care came into effect on the 12th of October, and the order for acute care came into effect on the 26th of October. This was not done lightly. It was done with a great deal of thought and deliberation and an effort to balance the rights of individuals to make decisions about themselves and their vaccination status, but also our requirement to protect the most vulnerable patients and clients and residents who are under our care. So the order is provincial, and it is a requirement for every health authority in the province, including Fraser Health, but the actual application of the order is happening through our local HR departments. It is a very individualized process. For those people who have chosen not to be immunized, it is a very individualized process that starts with ensuring that all of their questions about the vaccine have been answered to the best of our ability. And if their decision is not to be vaccinated, then the HR process unfolds with the support of that person's manager and with the experts in our HR department. And it's a process that unfolds over time. These individuals are not terminated abruptly or immediately. They are initially placed on leave without pay. And then over time, the process will go to termination if they continue to make a decision that they do not wish to be vaccinated. No individuals have yet been terminated at this time, and we will continue to support anyone who is terminated long after that happens in order to ensure that we support them as best they can in their future career choices. The other thing I wanted to add to this is that there is the possibility of getting an exemption for those people who believe that for medical reasons they cannot or should not be immunized. There is the option of applying for an exemption to the provincial health officer. She has set up a small team of people who are working out of her office who will evaluate the request for an exemption and make a decision about whether or not it is indicated. That process is well described on the BC-CDC website, but if anyone can't find that information, we would be more than happy to help them with that.
Thank you, Elizabeth. Are there any public questions, Victoria?
Yeah, thanks, Jim. So we have a few from our live question feed. The first one is from Katie. When will the mask mandate be lifted for children in school? And I've not seen scientific evidence to show that masks do more good than harm. And I'll ask Elizabeth, Dr. Brodkin, to respond to this question as well.
Thank you, Victoria. The mask mandate in schools, again, is a provincial mandate. So it was something that was enacted by our public health officer, but it is applied to all school districts across the province. When we started the school year, it was applied to children in grades 4 and up, and it is now right down to kindergarten, given the significant number of children that we saw who became infected in the first part of the school year. I have not heard anything about lifting it. I imagine that that will not happen until rates of cases in the community start to come down. There is some evidence that we have crested the top of the fourth wave and we may be starting to come down the other side, although that is not uniform across the province. And there are areas that are doing really well in terms of their case rates and areas, particularly those where vaccination rates are low, that are not doing so well. So there is at the moment no talk about lifting that mask mandate, but it will come eventually when the case rates start to go down. And offering vaccine to children in the 5 to 11-year-old age group will probably have a significant impact on that as well. As far as its effectiveness, masks are effective as part of a comprehensive approach to disease prevention. They are one of the many layers of protection that do help, along with staying home when we're sick, washing our hands, and most importantly, getting vaccinated.
Thank you, Elizabeth. The next question is from Donna in Tawasin Delta. Basically, wait lists to find a doctor in South Delta are ineffective. Would Fraser Health consider formalizing and administering a geographically sensitive wait list for the community of residents seeking to find a general practitioner? And I'm going to ask Manpreet to answer that question.
Thank you, Donna. Attaching yourself to a physician is very important for individuals and families, and it is also very important, I think, as a priority for the ministry. As an authority, we work with our partners, which are divisions of family practice, and they maintain the wait lists. We also have, in addition, the primary care networks and UPCCs, which are the urgent care centers, which also have a goal towards attachment. And we realize that they may not exist in your particular community, but you can get services from whatever is closest to you. So we would encourage you to be in touch with your local division of practice, family practice, as well as whatever is closest to you in terms of a primary care network or the UBCC. Thank you.
Thank you, Manpreet. Next question is from Anne, and it's how do associations of people that use drugs apply for funding from Fraser Health? Asking for the status of overdose prevention sites in the region and whether Fraser Health will open temporary sites in the interim. People who have lived and living experience bring unique and important perspectives to the conversation about how we deal with this crisis. I don't think any of us would disagree with the statement that the opioid crisis is another crisis in this province that's killing actually more people than the COVID crisis. Fraser Health currently funds 2 established associations of people who use drugs, Drug War Survivors in Abbotsford, and diverse organization providing education and resources society. Fraser Health also funds and supports peer work in community organizations such as Rain City, Lookout Health, and Housing Society, Purpose Society, Sierra Society for Women, and Mission Community Services. We also get money from the government to provide funding for Fraser Health to expand services for drug users, including overdose prevention services. With regard to overdose prevention services, Fraser Health sought proponents to deliver a service through a request for proposal. It's called an RFP, and so we seek input from people who want to provide that service and then make a decision. And of course, any agency, body, or including associations of people who use drugs are able to apply. 5 RFP processes went out for tender and were awarded to various agencies. Establishing overdose prevention services includes consultation and discussion with various municipalities, mayors, councils, and other stakeholders such as business improvement associations and local neighborhoods. While we continue to work with the applicants to address any barriers, we're establishing mobile overdose prevention services as a temporary measure until fixed sites locations can be established. Again, thank you for the question, and thank all the people for the work that they do on this important issue. Again, it's something we are taking a lot of work, doing a lot of work in Fraser Health about. The next question is looking for, Liz is from Liz in Maple Ridge, and she's looking for information about COVID-19 vaccines and their safety and their health issues. And I'm going to ask Elizabeth to answer that question.
Thank you, Jim. The best and the most comprehensive source for information that is easy to access that I know of is the Immunize BC website. If you type in Immunize BC into your search bar, it will come up immediately. And there is a great deal of information there about the vaccines, how they're made, what is in them, how they are administered, what the side effects may be. It's really a very, very good source of information. It's put together by the technical experts at BCCDC and some of their counterparts around the province. So as a first step, I would encourage you to visit the Immunize BC website.
Great, thank you. The next question is from Barbara in Abbotsford. And the question is, how can people like Barbara in Abbotsford find out information about her community vis-a-vis COVID rates, etc., and find out how many tests are performed, etc., in their area? And I'm going to ask Victoria to answer that question.
Thank you, Jim. In terms of the information that's available, there's multiple areas that you can look at. I think the best website that has comparative information, not only for Fraser Health, but the rest of the province, is BCCDC. Fraser Health also has sort of links to relevant information that's factual and available. And those options also provide you with ability to go broader into health service delivery area and local into smaller areas like Abbotsford. Now, in terms of specific municipalities, sometimes difficult to get that information directly because they're combined in local health areas. For instance, for Tri-Cities, the 3 communities are combined together to provide information overall instead of just one community. But it's because of the size of the community and the number of cases, number of vaccinations, et cetera, that we're dealing with. But BC CDC and Fraser Health websites are what I would recommend.
Thank you. The next question is from Christina in North Burnaby, and she's wondering about travel. I just got my third Pfizer vaccine and will be traveling to Paris for Xmas to see my daughter. Now, she caught COVID last year and recuperated and got her first Pfizer shot, but in France, they only give one shot to those who caught COVID. Question, are we safe? And bringing together without masks, since I'll be in her home, and being together without masks and being in her home. I thought, Elizabeth, that would be one for you.
Well, first of all, congratulations on spending Christmas in Paris. That sounds
Yes.
absolutely lovely. I am confident that you and your daughter are both adequately protected and will be safe, and you can safely visit together in her home without your masks on.
Yes. Have a safe trip.
Mhm.
The next question is from Victoria in Abbotsford. She waited for 8 hours in a local emergency room and went to the Surrey Pediatric ED and was seen a lot faster. Will there be more pediatric emergencies? And I'm going to ask Lori to answer that.
Hi, thanks for that question. So Fraser Health does not have any plans currently to build separate emergency departments. However, every one or most of our community hospital emergency departments do have what is called a pediatric zone. But to answer your question, every patient that presents to any emergency department, whether it's adult or pediatrics, are assessed and seen based on their urgency or acuity. So your wait time is usually reflective of your acuity as you present. Thank you.
Great. The next question is from Norman and Rebecca in Port Moody. And they shared a personal experience where they were sent to a Royal Clement Hospital ER by a GP and later sent home by Royal Columbian and admitted by St. Paul's. Seeking information on why GP sent them to RCH instead of St. Paul's. Lori, that's another one for you.
Yeah, thanks for that question. Unfortunately, it's hard to give you a fulsome answer without knowing a little bit more detail on your condition. However, I would probably guesstimate that your GP felt that your condition warranted perhaps sending you to your closest emergency, that was Royal Columbian Hospital. And at the time that you present into emergency, it's up to that physician at the time to make the determination of whether your condition warrants being admitted to that hospital. So unfortunately, I can't speak to why you were released and why your GP then sent you to St. Paul's. So it may be something you want to follow up with your GP that sent you there. Thank you.
Thank you. The next question is from Hannah in White Rock, and she was asking about information reported in a CTV news story on acute care outbreaks. And really the question, which is the one we keep asking ourselves a lot, is what lessons can we learn so that we can work to stop these from happening? And I'm going to ask Elizabeth to answer that.
Jim, thank you very much. And I want to thank you for this question because I know that this particular item did get a lot of attention, and I'm very grateful to have an opportunity to speak to it. So speaking in general about how we manage acute care outbreaks and how we learn from them, there are fundamentals for managing outbreaks of any kind in acute care, regardless of what particular pathogen or what particular bug has caused that outbreak. And that's the core work of the acute care infection control team. But on top of that are the specifics that we learn about each individual pathogen, the quirks and the issues that we need to know well in order to do a good job with that particular bug. So norovirus has its quirks. Influenza has specific issues. C. difficile has specific issues. And as we have managed outbreaks caused by each of those individual pathogens, we've learned about them and have become better and better at managing the outbreaks that they cause. COVID is no different. When COVID first arrived in our hospitals, we applied those basic principles of outbreak management to dealing with the outbreaks that occurred that were caused by the virus. But over time, we also learned a lot about how that virus works and what were the specific things that we could do that we could apply to those outbreaks in order to best manage them. So in that way, the learnings from each outbreak are applied in an iterative fashion to the next outbreak, and on we go. So over time, we get better and better at managing them because we have accumulated all of those learnings from the previous outbreaks. And in Fraser, we have actually captured those learnings in something that we call our outbreak playbook and toolkit, which is almost an encyclopedic document that talks about how to manage COVID outbreaks effectively, that is not only used locally here in Fraser Health, but is actually being requested by many of our colleagues provincially and outside of British Columbia. And it's something that we can be very proud of. Speaking specifically about the news coverage about the FOI, the following Freedom of Information request about any reports that we might have on acute care outbreaks, we did deliver a series of reports with redactions. And redactions mean that certain parts of those reports were blacked out so that they couldn't be seen by the person who had requested the reports. And it's important to understand that those reports were written not at a high level, but they were written by our epidemiologists. These were detailed investigations into each of those reports that took the form of following the journey of every single case in those outbreaks, all of the patients, all of the staff who were impacted, and following their journey to understand where they were exposed, when they became infected, where they were when they were infectious, and how they might have transmitted to the next person in the outbreak. And that information makes up the bulk of those reports. And obviously it is very personal. It is confidential medical information. It would be quite possible to identify the individuals from reading that information, even though they're not specifically named in the reports. And that kind of information cannot be shared and therefore is redacted before the reports are given to the person who's asked for them. But what was not redacted, and what I think is important from a learnings perspective, is the conclusions that we reached from each of those reports about what are the risk factors for transmission of the COVID virus, what are the things that cause outbreaks, and how do we prevent the next one. And that information was not redacted and was shared publicly.
Thank you. We'll go to Victoria now for live questions.
Thanks, Jim. We've got a lot of live questions, and we have a similar number of questions from Mike, Taylor, Aaron, and Katie, who have asked, we're hoping to get out of this pandemic and back to normal again. To support further vaccination, can you point out any provinces or states or countries that have already achieved high vaccination and have fully returned back to normal? Also, can you point out any studies that indicate vaccines will bring our society back to normal, or comment on the science of how vaccines protect our people or population? So I'll ask Dr. Brodkin to tackle that three large umbrella of questions. Go ahead.
This is another great question, and thank you. And I think that there are two parts to this. The first is, does high vaccination allow us to get out of this pandemic? Vaccination is our best tool for, if not getting out of the pandemic or not ending the pandemic, at least getting as close to that as we can. Vaccination was our ticket out of smallpox. It was our ticket out of polio. It was our ticket out of measles, and it is our ticket out of this. And therefore, among all of the things that we're asking people to do to protect themselves, vaccination is number one. And I don't have to go far to show that vaccination has been effective. I can just look at our own health authority, and I can see in every one of our communities that case rates, the number of new people who are becoming infected, and vaccination rates actually mirror each other perfectly. And those communities in Fraser Health with high vaccination rates have low case rates, and the opposite is true. Those communities with lower vaccination rates have high case rates. And that pattern is not just present in Fraser Health, it's present everywhere where vaccination has been rolled out. So we know that the higher the vaccination rates in our population, or in any population, the lower the case rates and the better we're all protected. As far as getting back to normal, the normal that we evolve into is not going to look like the normal that we had before this virus arrived. Our lives have changed forever. And although we can move to a new normal and a good normal, it will not look the way normal did in January of 2020. This virus will become endemic, meaning that the pandemic will ease, but this virus is going to become part of those viruses that we have that circulate all the time. And we will have to continue to do things to protect ourselves against it. For example, I suspect that regular booster shots will probably become a reality for us, just as booster shots for flu are something that we do every fall in order to protect ourselves and those around us. So yes, we can get back to normal, but it will be a new normal, not exactly the normal that we had before. And the faster we get our immunization rates up as high as we can, the faster that will happen.
Go ahead, Victoria.
Oh, okay. There's another set of questions from Sarah, Melly, Kyla, and Victoria, and they have questions about birthing and delivery, maternity visitations in hospitals, access to neonatal ICU for people that are not vaccinated and are doulas considered visitors. So I think overall the question is around what does the visitation policy look like for acute and hospital services? And I think first of all, in that specific area, what a lovely time to celebrate in terms of bringing new one to life. And I must also say that with the pandemic, we've seen an increase in births in our region as well. And we're the fastest growing region, but we've also seen an uptick with the pandemic. And I understand, appreciate where the questions are coming from. Important time to be together with your loved ones. Right now, we're currently looking at visitation policies at the provincial level and working with regional partners to see what are the essential visitors, who are the compassionate end of life cases where the vaccine policy might not apply for visitors, but overall vaccines will be required for visitors, but there will be some exceptions, whether it's essential visitors, end of life, or in certain cases, it might also look at a specific time of life, and that is to be determined. And as soon as that policy is available, we will be sharing with you through our website and publicly posted.
Thank you. Any other questions? Any other live questions?
Looks like we've got another question from Keisha. Why are we requiring vaccines in settings when transmission has been normal or low in some of these settings? So I'll ask Dr. Brodkin to respond to that question as well. It looks like vaccine mandate around specific public places. Go ahead.
Yeah, I think that there may be two pieces to this question as well. I'm wondering if the first piece is why are we requiring vaccination of healthcare workers in settings where we perhaps have not seen a lot of outbreaks or transmissions? And the second part of this, why are we requiring vaccinations in some public settings like restaurants and sporting events when there may or may not have been transmission in those settings? I think that as far as healthcare is concerned, the risk to our patients and our clients and our residents is always there. These people are incredibly vulnerable, and it just takes one infected person to bring a disease to somebody who may not be able to protect themselves, that could have devastating or even fatal outcomes. And the bar is so high for us to protect those who are under our care that Dr. Henry made a decision to require anybody working in healthcare in the province to be vaccinated. As far as public settings are concerned, there is not a requirement to be vaccinated before you can enter public settings that are considered essential. So none of that is closed off to people who have chosen not to be vaccinated. What is closed off are the discretionary settings: restaurants, bars, nightclubs, sporting events, these kinds of places where we don't have to go, but we like to go. And in fact, these are settings where we have seen transmission because people tend to gather in significant numbers. They tend to let their guard down because these are places where they go to have a good time, to be entertained. And we have seen transmission in these settings. So in order to better protect everyone in settings where attendance is discretionary, we are also requiring vaccination.
Thank you. Any more live questions?
Yeah, it seems like there's a lot of questions that are coming in. The next question is from Gerald and Esther. What is going to happen to hospital wards that do not have enough staff to run now? I think the question's referring to significant staffing concerns that we have seen publicly across the province, across the country, actually globally as well. And what are some of the solutions and what are we going to do to ensure that we provide the pivotal health services?
Yeah,
I'll
it's
ask
a
Cameron
great
too.
question. Very timely as we're now in the week where if you work in healthcare or employed by a health authority, you can no longer work without being fully vaccinated. So we as a health authority have been keeping a very close eye on our units across the organization as to where we believe we may have staffing shortages due to the mandatory vaccination order. We've been working very proactively with those areas to ensure they've got strong staffing and operational plans in place. So where we are able to, we are bringing in more workers, more staff where needed. We're looking at where we can be utilizing our people most effectively across the system. So far, so good. We've been able to mitigate our staffing issues to date, and we continue to keep a close eye on that as we progress implementing the mandatory vaccination order for our healthcare workers.
I have a question here from Carolina Gale in White Rock, and really this is an issue that comes up quite often, actually, and I've heard a number of stories about, which is that personal experience and concerns related to the admission under the Mental Health Act, wanting more information about the checks and balances of this act. And this is really an act that allows people to be admitted to and retained at the hospital for a period of time if there's an analysis that there are mental health issues that they need protection. And I'm going to ask Norm to give some details about how that works, because it's a very important thing that we do, but also we're very conscious of using it properly.
Thank you very much for that question. And as Jim mentioned, it's a very serious issue when we look at and make decisions around admitting someone under the Mental Health Act. It's not a decision that's taken lightly, and the initial focus of the decision is ensuring that we are stabilizing that person and providing immediate and urgent support to them in that moment, and with a goal that we will remove the admission under the Mental Health Act as soon as possible. The Act itself includes a number of checks and balances for individuals, including that the order must be made by a person with special Mental Health Act oversight responsibilities. The admission, any admission longer than 48 hours needs to have the agreement of a second physician, and that there must be ongoing regular medical reviews of the decision to admit somebody under the Mental Health Act. The Act also includes a number of important client rights, which include the right to appeal to a judge or to the Mental Health Review Board about the decision, access to lawyers or legal advocates, as well as a right of a second opinion. And we're required to inform a close family member or another person of the decision so that they can be there as your advocate. We also monitor the implementation of the Mental Health Act with an oversight committee that includes clients and families that have had lived experience. And it's very important that we hear from them about the experience of when they're admitted under the Act. And we consider that to take a client-centered approach and to ensure that we're looking at all options before such a serious decision is made.
Thanks, Norm. Victoria, any more live questions?
Yes, we've got a question from Roberta. When will we hear about the survey for the future of Heron Hospice in Irene Thomas Society or the hospice area? So I'll ask Norm Peters to respond to that as well.
Yes, as we communicated earlier in the summer, we were going to go out and start engaging with the community around the future of the Sauvage Wellness Center. So that is the second building that is located adjacent to the Irene Thomas Hospice. We've just started that process, and we will be sharing some additional information on how people can provide their input and feedback on the future of the building. We want to ensure that it meets the needs of the Delta community into the future, and the input from the community is a really critical part to that. So we look forward to gathering more information from the community and the various stakeholders in Delta.
Thanks, Tom. Victoria.
We've got another question from Dwayne. Rink to rink, city to city, there are different rules about attending U22 hockey games. According to the BCHO events, like this should not be checking passports if attendance is under 50, but we've been to many rinks that won't let me in as I cannot get the vaccine. How come there isn't parity from city to city, and why and how can these enforcements or how can they enforce stricter rules than what the BCHO states? So I'll ask Dr. Brodkin to respond to that question. I think it's getting to why are the rules different for different municipalities and for sporting events specifically, and can it be higher level of requirement than what it's minimally required at the provincial level?
Thank you, Victoria, and thank you for the question. I agree that this landscape has become confusing because there are orders that apply at multiple different levels. There are the provincial health officers' orders which apply across the entire province, but layered on top of that, there are orders, local orders in some specific regions. For example, Interior Health had their own set of orders, and in Fraser East, we have our own set of orders that are layered on top of what the province is requiring because we have a specific and elevated risk in those regions. So that may be part of the reason for the confusion. In addition, there are different rules at youth sporting events and adult sporting events. We are more permissive about who can attend at youth sporting events because of the importance of sport for youth mental health. And there are more restrictions when it comes to adult sporting events. So those are reasons why the landscape may appear to be different. In addition to that, it is difficult to interpret the rules. And we do know that sometimes the local arenas make mistakes because they're becoming confused by all of the different permutations and combinations. And Dwayne, if you have a specific scenario that you're looking for an answer on, I would be very happy to assist. Our health protection team can take a look at your specific question and your specific circumstance and help sort through it and let you know exactly what is permitted and what isn't under the orders. The other thing that I want to add is that right now, the provincial health officer has set up a process for evaluating requests from healthcare workers who cannot be immunized for medical reasons, and that is fully occupying that group. But we will get to a place where that same group can probably evaluate requests from people who are not healthcare workers but cannot be vaccinated and still want to be able to attend hockey games or whatever it is they like to do. And their medical issues can be evaluated as well, and a determination made whether or not they can get an exemption to the vaccine passport. We're not there yet. We need to get through the healthcare workers first, but that is a possibility that's coming for people who have been unable to be immunized for whatever reason.
The next question that we have is from Will. I live next to the Royal Crescent Modulars in Maple Ridge. Coast Mental Health is contracted to provide services at that facility. Yet in speaking to the residents there, I hear numerous complaints about the staff and the physical condition of the facility. What are the plans for more supportive services for the homeless population in Maple Ridge? And I'll ask Norm Peters to come back and respond to that.
Thanks for the question, Will. So I will, following this meeting, ask my team to go and check in with the residents there to see what concerns they may have. But just overall, housing is such a critical component to helping support people in the community. And we work in close partnership with BC Housing and local governments to improve and increase access to low barrier and supportive housing in all of our communities. We're very interested in continuing to work with the community of Maple Ridge and increase supportive housing in that location. And BC Housing has been working closely with them, and ideally we'll be supported by Maple Ridge to increase supportive housing in that community. And with that comes the supports that Fraser Health can provide through our mental health and substance use program. Because I said housing is such a key component to helping support people in the community. And we're very interested in increasing it, and we'll continue to work with BC Housing and local governments to increase it. But we will follow up on those concerns respect to this one location.
Thank you, Norm. We also have a question from two people, Dory and Aaron, around why we're experiencing outbreaks in long-term care and assisted living facilities, even with high vaccine rates. And I'll ask Dr. Brodkin to respond to that question as well.
Thank you, Victoria, and thank you for the question. I don't think there is anything that has caused more distress in this pandemic than what has happened in long-term care. It has been very, very difficult to watch, and an enormous amount of thought and time and effort has gone into trying to mitigate what has happened there and the particular vulnerability that our seniors and elders have to this virus. I think there are several, this is a great question, and I think there are several reasons why we are still seeing outbreaks in long-term care. Not still, actually, again, because we actually went through a period in the summer where we had no outbreaks in long-term care. It was wonderful. And then the fall came and the outbreaks started up again. And we do once again have a significant number of outbreaks in long-term care, although overall they are not as bad and as devastating as the ones that we saw earlier in the pandemic. I think there are several reasons why we're seeing outbreaks again. I think the first is that the people that were immunized first, when we put that first dose into the first arm on December 15th, it was into the arm of somebody working in long-term care. And following that, very quickly, we started delivering doses as well to the people that were living in long-term care. So they were immunized first. They have been the longest since they had their first dose. And for many of them, the longest since they had their second dose as well, because we worked very hard to get those doses into both the staff and the residents in long-term care early on. So they've gone many months since they had their first and their second dose, meaning their immunity has had an opportunity to wane. And in addition, they probably had those two doses closer together, because the decision to extend the interval between the first and the second dose didn't come right away. It actually came a number of weeks or months into our vaccine delivery program. And people who had doses later on probably went weeks between the first and the second dose. Earlier on, the interval was much shorter. And we now know that it is actually beneficial to have a longer interval between doses. Your immune system works better, and not just for this vaccine, but for most vaccines. And that is something we've learned and applied. So we have a group of individuals who were vaccinated early, who probably had a short interval between first and second dose. And on top of that, in terms of their immune system's health, are probably the most vulnerable. Your immune system doesn't work as well when you get older as it does when you're younger. And the older you get, the more true this is. And I suspect that for those seniors and elders, the response that they mounted to the vaccine at the beginning was probably not as robust as it was for the rest of us and people who were, down into their 30s and 20s, et cetera. So vulnerable people to begin with, long interval since vaccination, but a short interval between doses. And once again, they are vulnerable, and we're starting to see those outbreaks. And in response to that, we are rolling out vaccine, third dose vaccine, a booster dose of vaccine in long-term care as fast as we quickly can. And we hope and expect to be done that process, to have offered everyone their booster dose in long-term care by the end of this month.
Thank you, Elizabeth. We have, it seems like last question from Amy and Stephen. Can natural immunity be considered as vaccinated, and why is that not being considered? And I'll look to Dr. Brodkin again.
A really good question, and I don't yet have a really good answer. Getting the infection certainly bestows some immunity on the person who had it, but we don't have a robust understanding of exactly how much. We have very good knowledge about how much protection vaccination provides, and the first dose and the second dose, et cetera. We don't know as much about how much protection somebody gets from having had the infection. So until we understand that, the recommendation is that everybody gets their full dose of vaccine, first dose followed by second dose, and now the booster dose is coming for all of us in the next number of months, because that is what we are confident will provide the best protection, even if you've already had an infection from the virus.
Is that the last question, Victoria? Great, good. And it's 6 minutes to 4. Listen, I hope that those answers were satisfactory for people. I learned things today. I hope everybody learned something. It really has been a pleasure to be here. Although I will love to have public meetings together with you, and we can sit down and talk face to face and talk after meetings and do all those things that we did all our lives. And I'm hopeful that day is coming around the corner. I do want to thank the technical staff. This was a challenge for them, and this came off seamlessly this afternoon, which is a good sign because we may not be able to go and see you in public soon enough. And I guess at the end, just a reflection, I want to just again thank the people of the region for their patience, for their concern, for their caring of each other. It really is a disease that is on one hand profoundly antisocial, that in fact the people you live with can share it with you. On the other side of it, it's a profoundly social disease. In other words, at each stage of each stage of our battle with this disease, it was the collective effort of people, whether we're staying 6 feet apart, whether it was isolating in our houses and the loneliness that caused for people, and we know it did, whether it was getting a vaccine to be able to make it work because everybody had to get it or the vast majority to work. At each case, we had to rise up together and meet the challenge. And I think that's something that I am going to be eternally grateful for and proud of. And the reason that we actually have somewhat under control today. And so again, thank you to all of you in this region. We do have emails as board members. I have an email if you have questions. You're welcome to contact the authority itself if you have questions. We do want to be responsive to your needs. So I just want to conclude again by thanking the board members for the job they've done over this last year. We've certainly had to roll up our sleeves and get involved like everybody else, and to the senior staff and to the healthcare workers. So thanks again for joining us, and hopefully we'll see you again soon. Do we stay here now?